Great. So, welcome everybody. It's fantastic to see so many people joining us and wanting to study medicine. So, welcome to the UCL Medical School Open Day. Welcome to the virtual space. My name's Sarah Bennett. I am the admissions tutor for the medicine degree programme at UCL Medical School. I will be starting off, and I'm joined by Professor Faye Gishen, who is the director of the medical school, and we will both be presenting to you today a little bit about the medicine programme here and the entry requirements to get into medicine at UCL. I'm joined in the background by some fantastic medical students of ours. So they will introduce themselves after the presentation, but will be there to answer questions in the question and answer section. And a couple of members of staff that are behind the scenes who will also be available to answer the questions that you have. So please do ask questions. That's what this session is for. So if you have a look on your screen at the bottom, there should be a Q&A function that you can click on and that allows you to type in a question as we go along. All questions are good questions. And so please do put questions in there and the team will answer by typing back, or we will choose to answer some of them live in our Q&A part of the session a little bit later on. So brilliant that there are so many people here. So please, let's start off. Where are you joining from today? I think there are a lot of people here, a lot of people from all over the globe. It's probably a lot of people from the UK as well, which is great. Fantastic. Some people from the Middle East, Australia. Wow, brilliant. America, gosh, brilliant. Lots of people from all over the world today. Brazil, wow. Well, I hope you're all enjoying lots of football from around the world as well. We certainly enjoyed a match last night where England did win. So we're feeling quite happy today. So brilliant to see you all here. Thank you very much for putting your location in there. So, a question for you. So, when did UCL first start training doctors? Great. So, lots of you have begun to answer that. Let's have a look. What's the correct answer? It is 1834. So all of those dates are very auspicious in UCL's history. So 1746 was when the Middlesex Hospital first opened. The Middlesex Hospital no longer exists. It is now subsumed into UCL Hospital. In 1826, UCL opened as a university. It was the first university outside of Oxford and Cambridge, the first university in London. It was there to train people who perhaps didn't have religion or were from different backgrounds. And so it was thought to be very different to Oxford and Cambridge. But the students that were studying medicine and healthcare were not allowed to go and study in the Middlesex Hospital to learn about patient care. So a hospital had to be built. And so that took a little bit of time. So it wasn't until 1834 that we started training doctors. And the Cruciform building, which is in the row in Gower Street, opposite the main UCL building, was UCL Hospital. In 1984, the Middlesex Hospital joined UCL Medical School to become UCL Medical School. And in 1998, we had the Royal Free joining us as well. And so that is why those dates are so important to us. Now, when were women allowed to join the medicine programme? This is an interesting question. And the history of women in medicine is fascinating. because women weren't allowed to study medicine nor to practice as doctors for quite a long time. In fact, there was a lot of segregation between men and women at university as well for quite a long time, until after the war, in fact, the Second World War. But the correct answer here was actually at UCL, 1878. So there are some very famous women that Elizabeth Garrett Anderson and Sophia Jex were pioneering women that set up a hospital, which then became the Royal Free Hospital School of Medicine. And so we did start training women quite early. And here's a fun question. Which of these particular films have been filmed at UCL? It looks like lots of you have seen these films. Great. They're good films. Definitely recommend them. And in fact, all of you are correct. So UCL has a fantastic portico building and a lot of historical buildings that are often utilized in films. So next time you watch a movie, look out for UCL because it might well be there. It might well have been filmed there. And in fact, lots of television series do take advantage of our buildings as well. It's quite fun seeing the film crews around the place. So that was a bit of fun to start off with. I'm going to stop sharing, but share now instead my slides that we will get onto to talk a little bit about UCL Medical School. So let me share. Apologies. One moment. Brilliant. And I shall hand over to Professor Gishin, who will start off talking about UCL Medical School.
Thank you very much, Dr. Bennett. It's absolutely brilliant. And even though we can't see each of you individually, it is so fantastic to have you on the call. Well done for being here. Well done on getting your GCSEs. Well done to your parents. Quite aware that there'll be lots of parents and carers on the call. So medicine is a brilliant career, and it's just fantastic that each of you is considering becoming a doctor and considering coming to UCL Medical School. And it's very exciting for Dr. Bennett and myself because some of you in this room will be UCL doctors and some of you will even look after us as we get older. So that's very exciting. We have a definite vested interest. So all medical schools in the UK are good, but why are we distinctive? Well, as Dr. Bennett said, we've been training doctors since 1834, so we have a very strong and long heritage of training UCL doctors. And this is our sort of vision statement here. We train a highly capable, patient-centered, that's super important to us, clinician, equipped to practice medicine in a professional, inclusive, and sustainable way, which is grounded in science and best practice. So you can see there, that's our vision statement. And often when I'm on the wards, I'm a palliative care consultant, people will say to me in the clinical setting, I bet that's a UCL Foundation doctor. And there's something about the doctor that we produce that is just very distinctive and very well-rounded and very compassionate. So we're very proud of the doctor that we produce, and we hope you will become one day. So moving on. Why come to UCL? Well, UCL, those of you who look at the rankings will see that we ranked 6th in the world for medicine in the QS rankings this year. So that's really pretty impressive, and we're top in London. And of course, UCL is a multi-faculty institution. So what we mean by that is if you come to UCL, you may be in halls or in clubs and societies with all sorts of undergraduate students or even postgraduate students, art historians, geographers, medical students, psychologists. There's everything and so many different things here to study at UCL. So there's a really, really diverse range of people and things that you can do. Lots and lots of clubs and societies. I think at the last count, well over 350, approaching 400. So there's something for everyone. And our course, which our students can tell you about and will tell you a bit more about, is a 6-year MBBS program. So, of course, you know that we have a BSc in our 3rd year, and we have a very strong grounding in applied clinical sciences and a very strong impetus and onus on research. That's one of UCL's big features. We use a variety of teaching methods across the course: lectures, small group work, large group work, self-directed study, tutorials, etc. And we really encourage our students to work together in groups. Medicine is really a team sport. You will be taught, if you come to us, by world-leading scientists and clinicians. We have a huge range of absolutely superb scientists and doctors and nurses and physios teaching on our programme. You have the opportunity at UCL to really focus on research through the mandatory BSc, so everyone apart from graduates undertakes a BSc. And we also have an MB-PhD programme. So if you come to us and undertake the competitive MB-PhD programme, you come out with a BSc, an MBBS, and a PhD. So it's pretty spectacular, really. We have a lot of onus on our vertical modules, which are around the worldliness that I described about becoming a doctor, clinical and professional practice, and there's more of that in a coming slide. And you get to represent your peers and UCL medical students. I know Dr. Bennett and I might be a little bit biased. Dr. Bennett was a UCL medical student, but we really have the most fantastic students at UCL. And then we intersect and partner with so many different hospitals and GP practices. So examples are over there on the right-hand side of the slide: UCLH, Royal Free, Whittington, Great Ormond Street, the National Hospital for Neurology and Neurosurgery, Moorfields Eye Hospital, and down there at the bottom, the Royal National Throat, Nose and Ear Hospital, which is just opposite us. So UCL, as I said, and as Dr. Bennett alluded to, we have a very, very rich heritage. We're one of the oldest universities in the UK. We covered that we opened in 1834 as a medical school, and we've had several pioneers and firsts happen at UCL. So Robert Liston performs the first anaesthetic covered operation in 1846. I actually saw his gravestone at the Highgate Cemetery recently. 1874, London School for Women opened, which we're very, very proud of. 1964, the Epstein-Barr virus was described by the scholars on the slide. 2010, we partnered with the Francis Crick Institute, and some of our students go there. And then in 2020, during the pandemic, we pioneered some absolutely groundbreaking patient life-saving devices which assisted during the pandemic. So what's unique about our programme? Our location right in the heart of London amongst these world-renowned hospitals that we spoke about. The academic focus of our course, there it is on the right, that's our MBBS curriculum map, and the access which we mentioned to research, including BScs and MB-PhD. Our course structure, it's a systems-based structure, so we often get questions about problem-based learning, etc. No, we are a systems-based approach, which is divided essentially into the scientific foundations in the early years of the programme, then the BSc, and then after that you would be immersed in clinical practice at one of the hospitals or primary care settings. But I do want to emphasise, because we get asked questions about this, there is exposure to patients from very, very early in year 1 of the course. So you will be meeting patients and be exposed to patients. Of course, we alluded to our students are the beating heart of UCL Medical School, and they'll tell you shortly about RUMS, which is quite an incredible collection of students all supporting each other. So how are you taught? I mentioned this a bit before. There's some pictures of some of the hospitals that we use. There's the Royal Free in the middle, the Whittington towards the right. and you would be going there alongside primary care placements in the latter 3 years of the course. I mentioned that there are lots of different ways that we teach you, and you will experience all sorts of different teaching styles, including the fact that our students are extremely privileged, that patients bequeath their bodies to our medical students, so we have full body dissection. It is an incredible honour to be able to learn anatomy and learn about the body and the anatomy, physiology, etc., through being able to actually dissect people who have been generous enough to leave their bodies. Another thing, all medical students are super interested in assessment. Some of you might be coming up to assessments of your own. And at the medical school, we have both formative, those are sort of practice assessments, and summative, so those are end of year assessments. And they take the form of both written, that's the applied knowledge test, a bit like multiple choice questions, single best answers, and also practical and clinical and professional OSCE exams. So that's where we test sort of patient interactions, and those are super important. And then coming towards the end of my section before I hand on to Dr. Bennett, a couple more slides. This is just an example of some of the hospitals that we partner with throughout the area, throughout the region. You can see we're going around the M25, places like Watford, Luton, Stevenage, and of course our primary care colleagues. We even go into Essex to Basildon. And then finally from me, we'd invite you to look at some of these QR codes to explore some of the options at UCL Medical School in greater depth. So you can read about our programme, you can read about the support that's available to our students. 6 years is a long time to be at university. London is an expensive city. Some of our students live in, some commute, some live further out, some live in halls. We welcome everyone from all over the world. And support is available. So when you start, you'll be buddied through RUMs with a mum or a dad in another year. We have mentors helping you transition into university life. We have lots and lots of bursaries and scholarships and all sorts of accommodation that's available to suit lots of different budgets. We recognise the financial costs, so we can talk a bit more about those if you choose to ask questions in the live chat or the Q&A. And as we mentioned, we've got a whole range of incredible clubs and societies, both in the medical school and UCL. And I just want to close before I hand over to Dr. Bennett with a good news story. So just in the press this week, we've got 2 of our MB-PhD students who have made the most impactful landmark discovery. These are medical students working with clinician colleagues about a breakthrough in childhood brain cancers. So this is absolutely incredible. Here history happens. I'll hand over to Dr. Bennett and chat to you later in the Q&A.
Fantastic. Thank you very much. We are super proud of our students. They are the future. You can be the future. It is an amazing degree to do. I saw one of the questions in the chat about why still do medicine. There are a lot of bad press out there about being a doctor. It is still a fantastic career where you've got the opportunity to make a difference in somebody's life. And no one can take that privilege away from being a doctor at all. So I hope we've convinced you that A, studying medicine is great, B, coming to UCL is a fantastic choice. So how do you get into medical school? Well, I've put a picture there of our senior leadership team in our fantastic scrubs. So we like to have uniforms for our medical students and to demonstrate that you are a medical student and to be proud of the fact that you are a UCL medical student. So admissions. We have around 3,000 applications every year. So we don't have places for everybody that applies. That means that the application process is competitive. We interview around 1,200 of those applicants every year. It's usually between December and February, and I'll talk a bit more about that in a few slides' time. And we have 337 places available, and that comprises 24 places for international students and 313 places for home students. We also have a contextual offer scheme, which is called Access UCL. And some of you on the call may well be eligible for that scheme. There is nothing that you need to do to apply for that. Your application will be assessed as meeting one of those criteria and will be flagged to us. And as such, we would assess your application separately. There is lots of information about that on our website, so do use that QR code to take you to the Access UCL website. So a little bit more information about the application process itself. So what do? Well, we wait for your applications to come through on the 15th of October. That is the deadline for medicine across the country. What we look for initially when we screen new applications is that you meet our minimum academic entry requirements. So at GCSE, that is English language and maths. At A level and IB, we look at your predicted grades. And if you've done them already, your achieved grades as well. So let's talk about that a little bit further. So the minimum requirements. At GCSE, it's a grade 6 or a B in English language and mathematics. Those are the only two subjects that we look for. We don't look at the number of GCSEs that you've sat or the range of other grades that you have. Obviously, doing well in your GCSEs is a good precursor to doing really well in your A-levels. And your teachers will obviously base your A-level predictions and how you're going to do on how you've done in your GCSEs as well. So doing the best that you can is a really good step forwards. We do allow students to resit GCSEs to meet those minimum requirements if that's necessary. So if you have a 4 or a 5 in English or maths, please do ask your teachers about resitting those alongside A-levels or IB. If you don't have GCSEs, there are alternatives. And so please do email into us if you don't have those. Email into the medical admissions team so that we can make sure that you have equivalent qualifications. Our standard offer at A-level is an A-star and 2 A's. So that is the minimum prediction that you are needed to be able to go through our selection procedure. The A-star must be in biology or chemistry. The third subject that you sit in your A-levels is entirely up to you. It can be anything except general studies or critical thinking. So you can study Italian, you can study home economics, you can study music, you can study geography, you can study physics. We don't score your application based upon that third A-level. It doesn't have to be maths, for example. If you're doing 4 A-levels or 5 A-levels, great. But it doesn't have an advantage in our selection process. We will only look at 3 A-levels and only ever give an offer based on 3 A-levels. IB equivalent is there at 39 points, where 3 subjects must be at higher level with a score of 6 or 7, and biology and chemistry must be studied at higher level. Our contextual offer scheme, as we've mentioned, Access UCL, allows you to apply with predicted grades of A, B, with the 2 A's to be in biology and chemistry. All applicants must sit UCAT in the year of application. So if you are applying this October, October 2026, you must sit UCAT this summer. And graduates, we absolutely love graduates applying to us, but appreciate that we don't have a specific graduate entry program. So all graduates will do exactly the same course as everybody else. You just won't do the BSc in year 3. So you'll move straight from the end of year 2 into the beginning of year 4. And we require that graduates applying to us have met that minimum threshold at A level of ABB, to include the study of biology and chemistry, and that you have at least a 2-1 in your undergraduate degree. So as mentioned, achieving grades higher than that, so having 3 A-stars or 4 A-stars or 5 A-stars, brilliant, but it won't give you an advantage in our process. We look for the minimum. Then what do? Well, we receive your UCAT scores to the university in November. We will have a look at those. We will rank them from top to bottom based upon the total cognitive test score that you get out of 2,700. We do rank our Access UCL contextual students separately and the overseas students as well. So a little bit more detail about UCAT. It's a common question. What UCAT score will get me an interview? And I wish I could answer that. It would make everybody's lives a lot easier, but unfortunately I can't. We've only used UCAT since 2025, so we only have 2 years of data. And the data for 2025 entry was obviously with an additional section to UCAT, so it was out of 3,600 at that point. 2026 entry was out of 2,700. The total UCAT score is used to rank students, and the highest scorers will be invited to interview. We use the SJT purely to further rank you. So you can still apply to us with an SJT score of 1 to 4. It doesn't affect your ranking unless we have lots of students within the same total cognitive score. We then use the score to further rank. There are loads of preparation resources that are available on the UCAT website, and we would strongly suggest that you look at those freely available resources because they are produced by UCAT. They have lots and lots of preparation webinars as well. They are the best way to prepare. And so, what were the scores that achieved an interview this cycle? So for Access UCL students, it was 2,080. For home students, 2,190, and for overseas students, 2,300. But it does depend next year on who applies to us and what the range of scores are for those students that do apply. It does depend on the number of applications. It does depend upon the number of students we invite to interview as to what that lowest score might be. So every medical school across the UK will tell you that they can't predict what the lowest score might be next year. And then what do we do? Well, we've invited you to interview. So for our home candidates, that's an in-person interview at our UCL Medical School site on University Street in London. For overseas applicants, that will be online. And we don't expect you to have to fly over for a day of interview. Our interviews are multiple mini interviews, which is the common format of interview across the UK at medical schools. We start from the middle of December and we run through to February. Each station that we run is 5 minutes, and you'll be with a single interviewer who will ask you a main opening question and then some follow-up questions as well to get more detail, to ask more about you as an individual as well. And the interview covers all of those NHS values and our own UCL values as well. We want to know more about you as a person. What motivates you to become a doctor? What preparation have you made for your application? What have you done to understand what it is to be a doctor and how you will be a doctor in the future? And so it does require a bit of preparation, but not over preparing, not learning answers. Please be yourself. Please tell us about you and your own experiences and understanding. That is absolutely the best way of getting through your interview. And the QR code that I've put there takes you to some resources through Medical Schools Council that have some great online preparation for you there as well. Work experience is also a common question that we get. So we don't have a minimum requirement for work experience, but it's there because we want you to develop an understanding of that career that is ahead of you, of working with people. And that's what's important about work experience, that you have worked with people, you've learned about people, and you've learned about yourself. And do you want to be caring for other people in your career? We understand that it's really difficult actually to get clinical work experience. So it isn't an expectation that that is needed, and we don't score candidates down for that. There are 2 main types. There is a caring or service role that you might take, such as voluntary work or working in a care home, working with those who are disabled, working with those with additional needs, working in schools, for example. But also observing healthcare, and that can be online, it can be on television. It can be seeing how healthcare professionals work on a day-to-day basis. And I've put their Observe GP at the top, the Royal College of General Practitioners, or put on some videos for you to watch and some guided reflection about that. And Brighton and Sussex Medical School do have some online work experience where you get to see some consultations with doctors and to think about the skills and the values that are being demonstrated. So you don't have to have worked in a hospital, you don't have to have shadowed a doctor. What's most important are your reflections. What did you learn? What did you understand about caring for other people? What did you understand about the healthcare setting? Is it something that you can see yourself doing in the future? And that's more important. And you can use those reflections in your personal statement and at interview as well. Medical Schools Council have some fantastic guidelines about that as well. And so finally, our advice to you: medicine is a tough degree. It's long. It requires commitment. It requires energy. It requires passion and motivation. But it's brilliant. And we would absolutely recommend it to you. Do some research though. Carefully read about medical schools. Look at their websites. Look at their values. Look at the course structure, look at the size, look at the location. Those sorts of things are important to you. Only you can make the decision about whether that is a medical school that you feel you will thrive in. Keep up to date with healthcare news. So look on the web, look on BBC News or Sky News, look at what's out there at the moment, what's going on in healthcare, because those are demonstrating that you are interested, that you are questioning, and that you understand what the healthcare setting is like. Medical Schools Council is a fantastic resource in the UK where all medical schools post information about their course, but also about general requirements of getting into medical school. And reflect on what you do. We're not asking you to do lots of other things. We're not asking you to be a high grade in a particular instrument or to be captain of the football team, but we're asking you to demonstrate that you understand the skills, the attributes and behaviours that are needed to be a doctor in the future. And for you, Kat, I do the practice papers that are online. Do them in a timed fashion. Have a look at the answers and discuss them with other people who are applying to medical school. It is the best preparation. So it is competitive. Sometimes it does take a couple of attempts as well, but don't give up. If that is what you want to do, you will show us that that's what you want to do. And so I would thoroughly encourage you to apply. So thank you very much for listening to the talk. I hope that that's answered some of the questions that come up in the chat, but we'll now move on to the question and answer section of this webinar. So first of all, I'm going to ask our three students to introduce themselves to you, tell you who they are and which year they're in, and also to perhaps tell us a little bit more about why they applied to UCL. And Joel and Lauren, as you're coming to the end of medical school, what have you enjoyed the most? So Josh, I might come to you first, if that's okay.
Yeah, sure. Hello, everyone. I am a second year medical student, now going into their third year, so into my integrated BSc. I would say the main thing that got me really interested in applying to UCL was definitely the hospitals that we're partnered with. I was quite interested at the prospect of doing research. At the time, I didn't really know what that sort of constituted, but I knew I wanted, or at least I was interested in that. And it really has paid off because UCL has partnered with such amazing hospitals and leading institutions, such as the Royal Free, UCLH, gives you so many opportunities to go to these hospitals and see leading consultants and be taught by some really great doctors. So that's been really great part of UCL. And I'd say the community has been awesome as well. The Medical Students Association, RUMS, has been great. And to keep it short, I would definitely say the medical school is so receptive to you as students. They go to far and beyond to try and accommodate you at UCL Medical School, try to make it as easy as possible to study medicine. They're super receptive to your circumstances during exams, and they really try and make you feel like, studying medicine is enjoyable. and they really try and get you through it. So yeah, I really enjoyed it so far.
Thank you, Joel. And we haven't paid you to say that, so that's brilliant. Thank you very much. Joel, coming to you next.
So, my name's Joel. I'm a final year medical student. And the question was, just remind me.
It's why did you apply to UCL and
Yeah.
what have you enjoyed the most?
I think what stood out to me at UCL was mostly when I turned up actually to the open day, the atmosphere of the place, the history behind it. And I liked at the time that the course was very much you're learning about the science behind the systems over the 3 years. You're building up your knowledge gradually. And by the time you get into the clinical years, you really have that confidence. And what I've enjoyed about my time here really has been that community of all of the different students, and us getting through that, what can be quite a challenging course at times, of course, but that's really made it worthwhile for me.
Brilliant. Thank you, Joel. And Lauren.
Hi everyone, I'm Lauren and I'm also in final year. I think for me, the main reason I applied was because I really wanted to do full body dissection, which now that I think back on it was kind of, I don't know if that would still be my main reason, but I absolutely loved it. I think it's just such a huge honor to be able to do that, and not many people have access to that kind of privilege. I also really liked the opportunity to do an intercalated degree, which was one of the highlights of my time at UCL. I'm trying to think of what's been my best thing other than the community, because that is what I was going to say, and I've both taken those answers. Probably also just the central London location. I hadn't really thought that much about that when I was applying, but I think it makes such a difference. Like there's always so much going on. And like when you leave lectures, whatever, there's so much to do. There's loads of other students from different universities all living close by as well. So there's plenty of people to meet. There's loads of events and talks and loads of really cool places to visit, like the British Libraries around the corner, the Wellcome Collection, all these places that you can just go during your lunch break and things, which I hadn't really thought about when I was applying, but I think I really enjoyed that as a student.
Thank you, Lauren. And as a student myself, long time ago for me now, but I think it was exactly that. It was the opportunity at UCL. That's what I enjoyed the most, is that there are so many opportunities to get involved in as a student to help your own development, to help you grow as a person so that you are really ready and able to go out into the wide world and become a really excellent doctor and well-rounded individual at the end of it, which is so important in medicine, that you have that good work-life balance. So we would strongly encourage students to take on other activities and to get involved in sports and clubs and societies, to be at the forefront of the university, which our students are. They do amazing things, and I think you have a fantastic opportunity if you come and study at UCL. So Faye, I know there is a question about, is it worth studying medicine? So as a practicing clinician, you've seen the strikes that have been going on. Would you still recommend it?
I would absolutely and wholeheartedly and sincerely recommend medicine. I think it is the most brilliant career. And I know it sounds a bit twee, but the complete privilege of being able to treat patients, to see patients at their best and worst times of their life is an absolute honor. And there's so much under the umbrella of medicine. You know, at some point, people get to diversify their portfolio. They can do research. They could do medical legal work. They could do education like Dr. Bennett and I do. They can simply stay patient facing, and that's absolutely wonderful. But I would wholeheartedly, despite strikes, despite things you see in the press, tell you that medicine, I wouldn't have wanted to do anything else.
Thank you. And I think Dr. Farah, who is the Deputy Admissions Tutor, has said exactly the same thing, is that we love our jobs, and we feel very privileged to do what we do, and so heartened to see that there are so many people who do want to study medicine. We will always need doctors for our NHS service. We want to keep our NHS, and we want to be able to treat patients, which is what we do every day. Thank you. So I am going to come to Lauren just to ask you a question about the IBSC. So there have been a few questions about what is it and what does it entail. So could you tell everyone a little bit more about the IBSC that you did?
Yeah, so the IBSc is an intercalated Bachelor of Science degree. So it means that you do a year of a different degree that's not medicine, and you can pick from a range of options. I'm pretty sure UCL has like the most options, I think, compared to other universities that offer an intercalated degree. And so I did medical anthropology, which is like the study of people and social systems and how culture and identity relate to medicine. It's quite broad and a bit random, but it's a humanities subject. It's very different to kind of the typical like biomedical approach that we look at in the normal medical curriculum. And so the year is a research-based year. So everybody does a project, either a dissertation, which is just basically a long written up piece of research, or people do lab work, where they do some sort of experiment and then write that up. And so it's a really good opportunity to gain exposure to research. I think a lot of people apply to UCL because it's such a good research institution. But I think especially when you're in school, you might not really know what research actually is and what it means. So I think the intercalated degree is a really good opportunity to try it out for yourself. And it's only a year, so if you really hate it, it's fine, because you can kind of realize that that might not be for you, and then you don't have to ever do it again. Yeah, so for me, I did like a 10,000 word dissertation on an area that I was interested in. And it was just a really good opportunity to try something different, develop my research skills, and just try something new. So I absolutely loved it. And you join a like new cohort of students as well. So I was in the anthropology department at UCL, so I wasn't kind of registered as a medical student for that year. And so I kind of got to bond with a whole different department and whole different cohort of students, which was really fun. Hope that makes sense. But it was great. I would really recommend it if you have the opportunity.
Fantastic. Thank you, Lauren. Joel, which IBSC did you do?
So I studied neuroscience in my third year, and it was a really interesting year because we were able to get into the detail of the most up-to-date research. I was always learning something new every day that I was there, and I was able to get really hands-on with it as well. So I really enjoyed it a lot, and it was something that I'd wanted to do for a while. It's probably part of the reason that I signed up for UCL.
Fabulous. And Josh, what IBSC are you doing next year?
Yeah, so I'm doing the anatomy, cell, and developmental biology IBSc next year. I feel like as a second year medical student, we're all really looking forward to doing the IBSc, as just a change to the sort of clinical adjacent teaching that we get. So yeah, I'm incredibly excited. And there's a large range of different things that you can choose. So.
Fantastic. Thank you, all of you. So we have around 20 different IBSc options for students that range from the core clinical sciences that you're learning in the early years to other clinical-based IBSCs like pediatrics and child health, general practice and research, clinical sciences, and global health, sports and exercise medicine. There is something for everybody. That's what we hope as you go through the programme. And as Lauren and Joel said, it is an opportunity, again, for you to develop your research skills. And a lot of medicine is evidence-based practice. And so it really gives you a good insight into looking at evidence, creating new evidence. We have some students who find out new things during their IBSc that they go on to publish about and to expand the knowledge and understanding of medicine and healthcare, and perhaps even then go on, as we talked about earlier, to our MB PhD programme, which is where you get to do doctoral study. So you take your research endeavours further so that you really do find out something new and novel through your research practice. Brilliant. So there were some questions about RUMs. So Josh, would you be able to just give us a little bit of an overview of what RUMs is all about and what opportunities are available?
Yeah, sure. I feel like RUMS, which is the Medical Student Association, that's tied with UCL Medical School, is one of the best things about UCL Medical School. So when you go to UCL and you study medicine, you're automatically enrolled, or you're automatically part of this society, which comprises about, I think, like 1,000 plus students. Um, and yeah, essentially, there's a number of different things that we run, such as like sports clubs. There's many different sports clubs, welfare initiatives, and also we run like tutorials and like study sessions as well. And the aim is to essentially make everyone at UCL, or at least try to make everyone studying medicine, feel as if they're part of the community. And I do think they definitely do it really well. I've loved my first 2 years, and it feels like so many different people across the years too, as part of RUMS. Um, as an example of my current role within RUMS, I'm the incoming academic vice president, so I'll be helping you guys with um, anything academic related, and helping you through your exams and things like that. So yeah, essentially welfare events, sports clubs, teaching, and just the wider community within UCL Medical School. It's really great, and I think yeah, it's something to look forward to as being part of this community.
Amazing. And actually, RUMS as the Student Society was the Student Society of the Year this year.
Yeah, I should have mentioned
which
that.
is amazing. And it just does demonstrate that across UCL, RUMS is such an inclusive and collaborative group of students, and every single student is part of it. And you really all do help each other to get through the course. Our goal is that 337 come in at the beginning and 337 go out at the end and become UCL doctors. And our student body are so good at helping each other and supporting each other through that. So questions about placements. So Joel, could you tell us a little bit more about placements across the different hospitals and what that's all about?
So with placements, that's in years 4 to 6 of medical school, and you're spending your time at a hospital on the wards as part of the wards, learning from the doctors in the ward rounds, sometimes getting bedside teaching directly from them, interacting with patients, taking histories, finding out a lot more about what that specialty is about, from a really hands-on perspective. And in years 4 to 6, you're spending the entire year rotating around one hospital across the different specialties. You get a really good sense of how that specialty works, how the hospital works more broadly as well. And you really tend to pick up your skills. So who you are at the end of 4th year is very different from when you start those clinical placements to how you get on by the time you're in final year, like myself and Lauren, for instance. So it's a really unique experience. I think especially at UCL, we do have access to some of the best hospitals and doctors in the world. And so it's a real privilege.
Brilliant. Thank you very much, Joel. Josh, can I come back to you for another question? There's some questions about a typical week for a student, which is difficult because it's different every single week. But for a student in the early years, what has it been like? What sort of working week do you have?
Yeah, sure. So I would say we have lectures, obviously, in second year from Monday to Thursday. We have a break in Wednesday where there's only one or no lectures, which is nice. But also alongside the theoretical science-based lectures, you do have clinical placements at times where you can go visit a hospital or a GP practice, where you can gain some exposure in your early years to the hospital or clinical environment. But also, we do have CPP teaching, or clinical and professional practice teaching, every week, where you go to one of the partnered hospitals of UCL Medical School, including the Royal Free, UCLH, or the Whittington, where you meet with a smaller group of students that you see every week, and you do more clinical focused teaching. So there's definitely some clinical exposure in the early years. It's not just all theory or science, which maintains a nice balance in your preclinical years. But yeah, alongside the teaching, there's a lot of time to do other things too. Like you can be part of a number of different societies, and it works nicely around all your lectures. So it's not just all science. So yeah, it's a good balance, I think.
Fantastic. Yeah, so we do try and prepare you for clinical placements in the early years of the course. So we apply your clinical knowledge, your clinical sciences knowledge to clinical practice in the early years. And we also have a curriculum of clinical and professional practice that runs throughout the program, which develops your skills in professionalism, ethics and law, social determinants and health, thinking about wider population health, and the impact that society has on healthcare. And so that runs throughout the program, along with your communication skills and clinical skills as well, which we think is a really important part of the program. We also make sure that throughout the program, we think about equality, diversity, and inclusivity. We are serving a very diverse population. We want our doctors to be diverse as well, and to be inclusive. And we also have sustainability and planetary health that runs through our program as well, to identify the fact that healthcare is actually quite unsustainable, and that we need to be thinking for the future. As future doctors, we need to be thinking about what can we do to try and help make the NHS more sustainable and to be sustainable ourselves. Great. So I have a question for Lauren. Do you have any particular tips for students who are applying to medical school?
Yeah, so I think the whole process of applying to medical school can be very overwhelming. There's lots of different components to get through, and I think it's very intimidating. And you also have to juggle your normal schoolwork and your normal lives as well. So I think just really be kind to yourself. I think people put a lot of pressure on themselves during this time, but make sure that you're still doing the things that you enjoy, spending time with your loved ones and stuff, because you have to be able to sustain yourself throughout this period of time. And I think when it comes to applying, trust your gut, apply somewhere that feels right for you. Make sure you speak to people who go to those universities if you can, or go and visit yourself to try and see if this is actually somewhere that you can see yourself for the next few years of your life, because it will become your everyday life. So you really want it to be somewhere that you think you'll thrive, and somewhere that you can see yourself living for a couple of years. So yeah, and just I think be curious about the profession, ask questions, and really consider if it is something that you do want to do. I think especially, as people have mentioned, there's a lot of negative press about the medical profession at the moment. So just making sure that you understand some of the challenges that come with the job, but also all of the various benefits as well, and that you're going into it as informed as possible. And yeah,
Thank you,
good
Lauren.
luck to everyone. It's very difficult.
Thank you, Lauren. That is brilliant. Yeah, it's to not get too caught up in all of the things that you think you have to do. Is do the things that you enjoy. Think about the transferable skills that you're developing, and think about the applicability to medicine. That's the key. There's no particular book, there's no particular research paper, there's no particular task or activity that you have to do that will get you a place. You've got to demonstrate your reflective ability. You've got to demonstrate that you understand what you're getting yourself into by going into the healthcare profession. That's what we want to see at interview, is the real you. There have been a few questions about graduate entry, which I will answer. So we encourage graduates to apply. So those are students who are in the final year of an undergraduate degree, in their third year, or who have done a degree before, who have achieved a 2-1 or above, and also meet our minimum academic entry requirements. You will apply in exactly the same way as all other students. And so we don't separate out graduates because it isn't a separate programme. So please do have a look at all of the medical schools across the UK. There are around 20 medical schools that do a specific graduate entry programme that is shorter, usually 4 years in length, and is a separate pathway and a separate application process. So it's worth looking at all the opportunities that are available. But we do have graduates. We have somewhere between 10 and 15 graduates on our programme every year, and who successfully complete our programme. But you'll go through 5 years of our MBBS programme with everybody else. Great. So I'm going to come to Professor Gishen, if that's okay, for your top tips for getting through the interviews. There are a few questions about that.
Oh, Dr. Bennett, it is a stressful time. I do remember my own interview at medical school, actually, which was a panel interview. I think you just have to show us, like you've heard in the presentation, show us your true self, bring your true passion, don't be stilted, don't over prepare, be yourself, be natural. Do some reading beforehand. If there's something that's really interested you, come prepared to talk about it. Talk to some medical students, talk to people who are undertaking courses at the universities you're applying to. And just, read around it and check that medicine, which, as colleagues have said, can be tough, is for you. But, we really welcome your application. Come and study with us.
Great, thank you very much. So Joel, over to you, or perhaps in our last 5 minutes, I might come to all of our medical students. I'd like you to give your top tip for students applying to UCL Medical School, please. Thank you. Joel, go first.
It would just really be to be yourself and to think back on all of the experiences that you've had over the last few years when you've been thinking about your medicine application. What have you learnt about medicine, the world that you're going into? Why does that interest you? Or what's something that's interesting about that? And let us know, because that's all the sort of stuff that we'd be really interested to hear, and try and enjoy this process as much as you can, because it is a long and quite consuming process as well. So it's important not to lose sight of that.
Thank you, Joel. You're quite right. I hope that you would enjoy it. Please bear in mind that you are also sitting exams. You've also got academic work that needs to be done and that you need to get the grades at the end of year 13. Don't burn yourself out. Be that well-rounded individual as you go through your A-levels as well, so that you are then well prepared to come and study at university. There is one more question that I think I might ask Josh, is about challenges. What are the particular challenges that you think you've faced being a medical student and being in London?
Yeah, as a Access UCL medical student myself, I would say funding is definitely an issue. I mean, living in London is great, it's amazing, but it is quite expensive. There are ways that UCL Access helps you and things that you can apply for. So that definitely helps. Moving into London, coming from a small town myself, was incredibly scary. A massive change in my life or my environment. So that was really hard to adjust to. But the people that you surround yourself with, everyone at UCL Medical School is so welcoming. And the fact that you're all trying to work toward this same goal, this responsibility of being a doctor, it really sort of ties you guys together. So yeah, the challenges, obviously the exams, the studying is incredibly hard, but a doctor I talked to once told me that the work always gets done at some point, and you do need to enjoy yourself. It's not a sprint, it's a marathon. You want to try and enjoy your time in medical school, don't burn out. And it is hard to try and maintain that balance sometimes. Especially in first year, I was trying to do everything, do as many things as possible. But yeah, I think it's hard to try and catch yourself sometimes. Sort of be present in the moment, enjoying the time in medical school. So yeah, exams and that, obviously very difficult, but you incredibly talented, and you should be proud for yourself, of yourselves for trying to embark on this journey of trying to study medicine. So yeah.
Thank you so much. Thank you so much to all my panel for answering all those questions. We've answered 169 in the Q&A by typing away. So well done. I'm sorry if we didn't get to your question. We've got through as many as we possibly could, but please do contact us. We are here to answer your questions. You can contact the admissions team. You can contact study@ucl.ac.uk if you have a particular question. Have a look at our website for contact details as well. We are running an in-person open day at the end of next week. I appreciate that I think quite a lot of tickets have been sold for that already. So we are actually holding another in-person open day in September that's specifically for medicine. So if you're not able to come next week, do look out on the website to sign up for September. And do speak to people, do ask us questions, do make sure that it is the right university for you, it's the right degree program for you. It is brilliant. So thank you very much for joining us. I know the webinar is finished now, but we will put up a little feedback questionnaire for you at the end. We'd love to hear your feedback about the webinar and what you've enjoyed and what we could do better for future webinars. And this webinar will be available on our UCL Open Day website in a few weeks' time for you to revisit as well. So thank you very much for joining us. Thank you for all of your questions, and we look forward to seeing your applications. Bye-bye, everybody.